Good morning, everyone. I'm Russell Myers, CEO of Midland Health, and this is our Unified Command Team briefing for Thursday morning, July 9th. We have a number of speakers for you today. I'm going to kick things off. I'll hand it off to Dr. Wilson to make some remarks. We'll continue with Mayor Payton. I believe Judge Johnson will be joining us, and then we'll close today's proceedings with a special message from Secretary Don Evans, who is a member of the governor's task force on reopening Texas. So we have a lot to talk about today, and we're going to dive right in. Some early statistics in the state of Texas: over 220,000 confirmed cases now, with over 2,800 confirmed deaths from COVID-19. In Midland County, we passed the 1,000 cases mark and have reached 1,020 confirmed cases with 19 deaths to date. Midland Health continues with our single drive-through testing site. I have more to say about that in just a moment, but as of now, we have 424 outstanding tests from our testing site. That is as big a number as I can remember. Most of those are from the last 3 days, but we do have outstanding tests as far back as last Friday. So we continue to see struggles with the send-out labs, keeping up with the demand that's coming to them from all over the country, and we're being affected by that. We do have some solutions, at least in the near term. One thing to note about testing, we don't have access to the data for everyone's testing, but those tests that we've been doing ourselves at our drive-through site and sending off have reached an average of about 30% positive over the last 4 weeks. Prior to this peak period, they were running less than 10% positive. So we're more often seeing patients who are tested and turning out to be positive if they have symptoms. The hospital census today is 164 total. We are at our all-time high now for COVID cases, with a total of 34. 8 of those are in critical care and 26 in our medical unit environments. I was asked the last time we met to provide an age breakdown on the hospitalized patients to give you a general idea of what we're seeing. I can tell you in critical care, they're pretty evenly spread from people in their 70s down to people in their 40s. In the medical units, we have several patients that are in their 90s, and we have a couple of patients in their 20s. And each decade cohort is pretty evenly represented from the 90s to the 20s. Our biggest group is those in their 50s, with a total of 9 patients. So a pretty widespread, pretty consistent in both critical care and the medical environment across all different age ranges. The hospital is, as you can tell, very full. We have 9 non-COVID critical care patients, as well as 8 critical care patients with COVID, 26 COVID patients in the medical unit. So we're hard pressed to accept any transfers from outside hospitals now. That's a process that's ongoing for us. When we close to transfers from outside the community, our team reevaluates that every few hours. We know we have an obligation to serve those around the region who don't have the capabilities we have, and we want to keep ourselves open to that as much as we can, but we can't promise to do what we don't have the capacity to do. So we're carefully evaluating that every few hours, and for right now, no critical care transfers are being accepted. We are still doing elective surgical cases and expect that we will continue to do so, but that continues to be a day-to-day, even an hour-to-hour evaluation, especially with regard to surgical cases that will require a post-operative inpatient stay. So for right now, we're still on track with those that are scheduled. Let's see, more on statistics. Ventilators, we have 9 in use. 7 of those are on COVID patients. Remember, we have 44 full service ventilators, so we've never run short of ventilators and are really not close to that at this point. We've talked about our employees a couple of times recently, and it continues to be a significant concern for us. We have a total of 53 employees now who have tested positive. Several of those folks have gone through the recovery period and returned to work, but we have many more who are actually being monitored now and have not tested positive. So lots of concerns about the continued availability of our workforce, of course, about the health and well-being of the people we care most about who work with us every day. But I am happy to report that no member of our workforce has been hospitalized. The biggest news that I have to report today is about testing, and it's multifaceted. What we've been working on for a couple of weeks and are now prepared to say will go live tomorrow is a new testing site. I think most people know that we've been testing at the back of our West Campus by appointment only for a long time now, for several months. Drive-through testing has gone very well, but all those tests have been sent out to outside labs, and they've taken multiple days to get results. Effective tomorrow morning at 9 a.m. On a limited basis initially, because we're trying out some new equipment. But tomorrow at 9, we'll have a new testing site open at the Coleman Clinic on East Florida Avenue. People are very familiar, I think, with the Coleman Clinic on the east side of town. So we'll have our West Campus site and the new Coleman Clinic site both available starting tomorrow, running Monday through Friday, typically 4 hours a day for the time being. Two things that are important to understand about the Coleman Clinic site. One is we are trying out a new piece of equipment. We have rapid testing capability on a fairly limited basis, and we're going to be using it at the Coleman site. So certainly tomorrow and perhaps into the early part of next week, we'll be scheduling a limited number of patients there to make sure that the staff can keep up with the volume, understands how to use the machine, to register patients timely, to do the whole process in a way that's efficient and doesn't promise more than we can deliver. As has been the case with our West Campus program from the very beginning, it will still be the case in both testing sites going forward. We will only test patients by appointment. The way to get an appointment is through 6-8 Nurse, and I think you see that on the screen now. Simple statement, if you have symptoms and believe that you need a test, call 6-8 Nurse. If your doctor has told you you need to go get tested, call 6-8 Nurse. We'll route you to the appropriate people, make an appointment for you, get you to the site that makes the most sense for you, and get you tested as soon as possible. We'll be using the Quidel Sophia 2 units at the Coleman site and hopefully at the West Campus site next week or in the not too distant future. Those units should be able to turn around results in about an hour, start to finish, for most patients. But we want to be sure we test that theory and make sure we actually can turn results around that fast before we open it up to widespread and high volume testing. So that's the testing story. I think it's a very good story, but we're still a little bit hesitant about going full blast until we prove it out, and we'll be starting with that tomorrow. The last thing I'd like to say about that is we've had great cooperation from the emergency management teams at the city and the county. We're using some city equipment. They've been very helpful in helping us set up logistics, procuring personal protective equipment, a lot of cooperation happening to get that Coleman site live, and thanks to the folks at the city and the county for helping us out. I'd like to ask Dr. Wilson to come up. He's got a couple of comments to make, and then we'll move on through the agenda after Dr. Wilson. Right.
Thank you, Russell. So I'd like to remind everybody, hearing a lot of information, and I think some of it is expressed in the framework of sort of frustration about the lack of progress, or that it doesn't seem like we've moved very far in finding cure for the COVID infection, the pandemic, as things have been going forward. I'd like to remind all of us that we're about 6 months into this pandemic, and it started off with hotbeds in California, or in Seattle, California, New York City. What was recognized pretty quickly with that was that the best cure, or the best way to slow the disease, was prevention, and would increase social distancing, increase protection of the vulnerable population, wearing face coverings, mitigating the exposure of others to the infection. They were able to dampen down their curves, slow down the progress of the disease, decrease the load on their hospitals and in their society, and begin to open up economically and begin to get back towards normal. Other parts of the country that didn't get hit as hard with the virus early on very quickly opened up when the opportunity was there to do so. And unfortunately, perhaps not with the same level of personal choice of being careful with social distancing, face covering, et cetera. So we've seen an uptick in disease in other parts of the country, including our own state of Texas and in our own area here in Midland. Since Memorial Day, the swing up has been very, very noticeable. We've had over 50 confirmed cases on a daily basis for a few days now. Our hospital has 34 patients hospitalized now. So I want to remind us all that despite the fact that we've made some great progress in terms of our treatments and keeping people well once they get infected, an ounce of prevention is worth a pound of cure. And if we prevent the infection, that's where we're going to have our best opportunities. Having said all of that, a lot of the information that's been out there about different kind of treatments, I'd like to remind all of us that we've made some great progress there. There's been the COVID convalescent plasma seems to be very successful in helping decrease the load of disease on individuals. Remdesivir has been out and been widely provided through the government, through Gilead, and helped reduce the length of stay in the hospital and mitigate the degree of illness that people have experienced with that as well. Recently, information about using IV and oral steroids seems to be promising for some of the more sick individuals in decreasing the inflammatory reactions and helping people stay better longer and sooner. And various therapies in the hospital, high flow oxygen, restriction of fluid to some extent, proning of the very sick individuals have all mitigated the mortality rate, decreased the mortality rate, helped people do better, longer, sooner. A lot of mixed information remains out there about hydroxychloroquine. It's been, the golden child at one point in time that kind of fell off everybody's radar screen. There seems to be some information out there again suggesting it might have some benefit. Figuring out the right population that it might have the benefit in still remains to be seen, but it's being utilized to some extent. Again, you've heard information about inhaled steroids. I've done as much homework as I can around that topic, and I'll touch on that again briefly in just a moment. And then last time we were here, I mentioned something about, or somebody else asked a question about ivermectin, I think it's called. It's an anti-parasitic drug. I hadn't heard anything about it, so I did a little homework around that and had some help from Kit Bredemus, our CNO, on that. And what we found is that it's been an anti-parasitic agent for quite a long time that seems to have some antiviral benefit. And it's been tested in vitro, so in glass tubes or in the laboratory, not on animal studies, for antiviral benefit. And it seemed to have some promising decrease in viral growth and development. So there may be some promise to that, but so far it hasn't made it into the medical literature. That's why I'd not heard anything about it, but it's in the research literature, and hopefully there'll be more information there going forward. So I just want to remind everybody that work is going on. We're 6 months into this. It's frustrating. I get that it's not fun to social distance and wear face coverings, but it is really the way to mitigate this disease, decrease the disease load in our community, and stay open and doing things the way that we like to be doing things again. So back on the inhaled steroids, I've done some homework around that. I found one valuable article in the European Respiratory Journal. In that article, they have no definitive information whatsoever. There's not been any large studies in its utilization. They do make some points. COPD patients and asthma patients are often on inhaled steroids. That's their therapy. In that population, it has been shown that there's been a reduced number, or they have less COVID infections than other populations. Now, could that be because of they're on the inhaled steroids, or is it because they're more careful because they know that they're at risk? There's no information to support that one way or another. What is recognized is that if they do get the infection, they have a mortality rate 3 times higher than the general population does. So it certainly is not curative if you're on inhaled steroids and you develop the infection. Whether it might help in prevention or not is not clear, and there are no definitive studies. I would love everybody to just take the time to be thoughtful about any new therapies that come along. We're all frustrated, we're all somewhat have anxiety around this, and we all want something that can just fix it. And the most valuable thing that can fix it right now is public health and prevention. And let science do its work and move forward, and hopefully we'll get to a better place in the near future. So if you get an opportunity, go online, research it yourself. I know there's at least one advocate out there for inhaled steroids being very, very beneficial. Maybe there's others. Most of science isn't there. Most of medicine isn't there. Be careful, be thoughtful, do your own homework, read it yourself, and come to your own conclusions. So, thank you.
Thank you, Dr. Wilson. I'll ask you to stay nearby because I think we'll take some questions now. We had agreed with each of the speakers that as each organization completes its remarks, we'll open to questions specific to those remarks and those organizations. So we're open for questions at this point.
We do have some questions from Facebook. How accurate are the rapid tests that we are doing?
The rapid tests are not going to be quite as certain as the PCR testing that we do in our own lab or that the many send out labs will do. There, I believe we agreed on 85% sensitive, which essentially means that you're going to get 1 to 2 inaccurate negatives per 100 tests. Do I have that right? 15, I'm sorry, 15 inaccurate negatives. So the risk is on the negative side. If those tests produce a positive result, we can be highly confident that that patient is positive. If the test produces a negative result, we can be about 85% positive that that's a legitimate negative. So it's not perfect. Patients with severe symptoms will still need to be careful about monitoring their own behavior and self-isolating. A negative test that there's reason to doubt can be rerun, can be confirmed on some other instrumentation. But the good thing about the rapid tests is that they're available. They turn results around rapidly, and we can avoid these lengthy waits. On the downside, I was told right before I came in here this morning that while we had initial good result in securing the machines and the test kits to run on those machines, the manufacturer has now put us on notice that they're moving to an allocation basis, meaning they can't keep up with the demand. We have, I think as of this morning, 1,800 test capacity in hand, and we're not really sure when or if we'll get more. So we'll use those as long as we can use them. There's the possibility there may even be a second type of rapid test that we can get our hands on, and we're evaluating that right now. But we'll use them as long as we can. Results will come out quickly, and if we have to revert to send out tests again, that remains an option.
We have a question from KWES. Go ahead. No. Okay, I think we're having some microphone issues. We'll work on that and come back to you. We have a question from Shane at CBS 7. Good morning, everyone. What kind of stress is a hospital under with more than 50 staff members out and a record number of coronavirus patients needing care?
A lot of stress. There's no question. We can't have that many of our coworkers affected by this disease and not feel a great deal of concern for them, as well as concern for our ability to adequately staff the patient care services that we need to provide. So we're very concerned about that. The census is high. It's a challenge for us we hate to turn away transfer requests, especially from the hospitals around us that depend on us to take their critical patients. But we're in that place right now. And so we're not only stressed ourselves, but the broader region is stressed. I had a call with one of the hospitals in Lubbock a couple of days ago, concerned that they were beginning to see more demand for transfers to in their direction from small hospitals that usually transfer directly to us. And that's true. That's part of our reality. As we run low on capacity, either staff or space, those patients are going to have to go farther and farther away when their needs can't be met in their own communities. So we have a wide variety of concerns. It comes back to Dr. Wilson's admonition that we should all be focused on social distancing and prevention. You're going to hear more about that from the other speakers on today's panel later on, and that's the most important thing we can do. Recognize we have a limited supply of resources here, human resources, to take care of the patients that need us. And we have to do everything we can to keep those people healthy and on the job.
There's a follow-up question. Do you have any more staff members coming from out of state to help?
We are constantly working that. There's a lot of demand for traveling nursing staff, especially. We've got a few in the pipeline. We're trying to find more, looking for every opportunity that's out there. But a lot of other hospitals are competing for those same people. So it's not an easy thing to do to get traveling staff. We've had some success. We anticipate getting a few more, but it's certainly not enough to replace everybody we've lost.
Thank you. We're going to go back to Channel 9 KWES and see if we can get audio this time.
Hi there. Just real quick, can we get the number of all the negative and the positive tests right now?
All the negative and positive tests. I
Yeah.
can tell you all the positives in Midland County. That's 1,020, and you can find that on the health department's website. They post that every day.
Okay.
I'm not sure what else is posted there. I don't have that in front of me. The total negatives, I'm not sure I have that number.
Okay.
Sorry.
One of the questions that we are getting is why are the recoveries so low in Midland County compared to Ector County?
Why are the recoveries so low? I think that recovery number comes from the health department, if I'm not mistaken, and I don't have access to their methodology. I suspect that many patients are lost to follow-up, and they just don't know. They don't want to count a recovery number that they're not confident of. But that's a question you really need to address to the health department to be sure to understand their methodology.
Okay. Just right now, if someone wants to get tested, what are all the options right now as far as testing goes?
I don't pretend to know all the. I can tell you the options that the hospital is responsible for, and they're all the options we have are available through a call to 6-8 nurse. So you call 6-8 nurse, you describe your symptoms, they'll make an appointment for you today, this Thursday today. The only site we have for that testing is our West Campus. They'll send you there with an appointment. Starting tomorrow, we'll add the Coleman Clinic site, which we'll also be operating. So that'll be 2 locations that the hospital operates, and both are accessible through a call to 6-8 nurse. I know there are other providers around the community that are offering testing, but I'm not in a position to list all of them for you. I'm sorry.
Okay, thank you.
Okay, we have a question from Caitlin from the MRT. Is the new testing site also going to be a drive-through location?
Yes, it is. Very, very well. We've got great access there at the Coleman Clinic. They've got a parking lot on what I guess is the east side of their building that is essentially assigned to us, and we'll have good flow and a team out there beginning tomorrow morning at 9.
A follow-up question is, and when you say appointments at the new site will be limited at first, do you know about how many appointments will be available?
We have talked in terms of about 30 for the 4-hour period. And I think they're going to gauge that as they go along, but that's where we're headed. I think we'd like to get them up to about 100 a day, but in the short term, 25–30% of capacity, just until we make sure we've proven the model. That may just be for Friday. We may be able to open wide next week, but we're going to test it and make sure we can do it right.
We have a question from Facebook. A 30% positive rate is far higher than the 5% positive rate that Johns Hopkins advises we should achieve, and may indicate testing only the sickest patients who seek medical attention, and is not casting a wide enough net to know how much virus is spreading within its communities. Do you foresee with this new testing being sufficient to get to a 5% positivity rate?
I can't speculate on the positivity rate. What I can tell you is that we do not have the capacity, and we do not anticipate having the capacity to test broadly throughout the community, to test all comers, to test anyone who believes they've been exposed, to do the kind of things that the Hopkins study assumes. If we're testing the wide population, including many people who have no symptoms and no exposure, then those lower positive numbers are most likely to result. That's not what we're doing. We're testing people with symptoms primarily. On occasion, we'll test someone who's had a very significant exposure or some other unusual circumstance that requires them to be tested. But by and large, we're testing people who have already developed some amount of disease. So it's not shocking to see our numbers pretty high. What is concerning is our numbers are considerably higher than in the first round when we were using the same rules and testing fewer people, frankly, because the demand has gone up. So our demand has gone up, our positivity rate has gone up, but it's still patients with symptoms primarily. So not a real direct correlation with the Hopkins recommendation.
Do respiratory habits have any impact on infection rate?
I'd have to ask you to clarify what respiratory habits would mean.
Her follow-up question, and I believe this might offer some clarification, is do mouth breathers have a higher chance of catching it?
We don't know. Sorry. I think all breathers have a chance of testing it if they're in an area that's highly concentrated, like when they're standing next to a person who has the disease and they don't have a mask on. So whether you breathe through your mouth or your nose or both, you're much better off staying out of crowds and avoiding people who don't wear a mask.
We have another question from KWES. Go ahead.
So is the hospital open to testing budesonide? And if not, are there any legality issues that come with it?
Well, the hospital is not a research organization to begin with, so we're not open to testing anything. Every day, clinicians in our hospital are making decisions on how to treat sick patients who are in our hospital, and they're using the best available research that they have seen and read and synthesized through their own experience and training. So, I don't. If you're asking, would we do a clinical trial on our patients? Absolutely not. There are a wide variety of ethical and legal problems with attempting to trial a drug like that in our setting, and that's not something we are set up to do or would consider doing.
Okay. One more question. Are there any certain blood types that are the most vulnerable when it comes to COVID-19 to catching it?
You know, we've heard a little bit about blood types, and what little bit I've heard, and I'll make sure Dr. Wilson checks me on this, is that type O blood seems to be more resistant. Whether there's anything more to that than that, okay, he's saying that as far as he knows, there isn't. So type O perhaps is a little more resistant. Otherwise, not really much to go on there.
Okay, thank you.
Is there a place to test our antibodies for free?
We do not do antibody testing for free. It is available in both our main and west campuses by appointment, but we'll ask you we'll either bill it to your insurance or we'll ask you to pay for it, and we're not doing that for free.
I believe that's all the questions we have. We can move on through the agenda.
Okay, very good. Mr. Mayor, I think you're up next, and I'll step aside.
Well, thank you, Russell, and Dr. Wilson, thank you, and for everybody who's on this Zoom call. I had reached out to the hospital yesterday to just simply ask them if we could jump in and be a part of this press conference with you to reinforce the messages that are so important right now. I want to go back to a question that was asked related to recovery numbers, because I had the same question of our health department yesterday. It seemed to me that our recovery numbers seemed to be lower than it needed to be. And part of that is echoing exactly what Russell just told you, which is another message that the health department wants me to also convey, which is connecting with the health department. Even though they're trying to do all the contact tracing they can do, they need you to answer the phone. They need people who have been infected with COVID-19 or have COVID-19 and been infected with the coronavirus. We need them to answer the questions, because what's happening is we're losing connection with people who are not helping us understand that they've recovered. So our recovery numbers, by anecdotal evidence, are a little bit higher, but we're not able to get those numbers simply because we haven't been able to connect with people once we've made an initial connection. So help us out. The health department's doing all they can do to track those numbers. They're working very long hours, very long weeks like everybody else is in this whole process. They're doing a great job trying to beef up staff, but it's very difficult, as you just heard, related to the hospital staff as well. The same is true for our health department. But I just wanted to take this time after Facebook Live last night and spending time with our community to really just tell you that there are really two major concerns that we have here. And the first one is the health of our community. And the second one is the economy and the success of our community. And those aren't separate issues. They're really two sides to the same coin. And right now, if we're going to do what we need to do, we're going to have to pay a little more attention, not a little more attention, a lot more attention to this health piece, just like we did back in March and April, whenever we all had to start doing the things like social distancing and the wearing of face masks and the personal hygiene, staying away. And we did all this, and we did it correctly. We did it right. And we were able to mitigate the spread of this virus. But now that we've gotten into this post-Memorial Day place, and we've seen our numbers being elevated, I want to join the chorus with our hospital, join the chorus with our health department, and beg you and ask of you that we all do the thing that we need to do and that we may not want to do, but we still need to do for one another, which is serve one another with this issue of wearing masks in public places and wearing masks when you cannot control the social distancing, and going about this sacrifice together. As I said in my Facebook Live last night, perhaps the greatest gift of freedom is not what it does for me, but what it enables me to do for other people. And right now we have the freedom to come together right here in Midland and also in Odessa and all over the Permian Basin. We have an opportunity when we're out in public to serve one another, to serve the vulnerable among us, to get our face masks, to have our face masks with us, and to wear those when we are in public, to wear those when we are in grocery stores, to honor the businesses that are asking us to wear those face masks when we go to their places of business and not resisting when they're asking us to, just like we've asked you to do at City Hall by way of example, to tell everybody, if you're gonna come in for an appointment, you're gonna wear a face mask, just like I am doing, just like everyone else is doing now that we've realized this is not something that was just an anomaly for a week or so. We're going to have to get control of this number. My biggest concern is if we don't take what we have to do, we don't take responsibility as a city and as individual citizens and put on the face masks, whatever the debates might be, this is the one we know we can do. And we put on our face masks, go about our daily lives and our work with our face mask on when we can't control the environment, when we're not at home, when we're not able to social distance correctly, we get our face mask on, we get our numbers down, and we get back to the other side of that coin. Once we get our health back to where it needs to be, we get the load off of our hospital, and we can keep moving forward with this economy that we need to have growing with a healthy community. So I want to thank you for tuning in last night. I want to thank the hospital for letting me barge into this press conference of theirs and join with them in this message and in this calling to our community. You've done it once before. You did exactly what we needed to do back in March and April. We can come together in July, maybe even into early August, and do exactly what we need to do to serve each other with putting on these face masks when we're in our community. So thanks for the time. And Tasa, if there's any questions I can take, I'll be happy to do that at this time.
No questions yet. We'll give them a minute or two to
And I'll
respond.
be on here to ask a question later.
Okay. We have a question from Mitch. Mitch, go ahead.
Hey, Mayor. I'm curious, you've been really vocal about your frustration with the governor's mask mandate. And I guess, do you worry that your protests of the mask mandate have muddied the calls for Midlanders to wear masks?
I'm not worried about it that it's muddied the waters. I'm worried about it because it's been misconstrued as a protest against the governor and a mask mandate. What I said in that first interview was the issue is not a mask issue. As I said in that interview, I said we are really encouraging our people and picking up the encouragement of our people to wear these masks. Where we've had different struggles and where we have had disagreements has been in enforcement. But the greatest enforcement right now is really one to another. The greatest enforcement is us as citizens, quote unquote, picking up our masks and doing this. So the more we're able to be clear about that message as citizens, one to another, and holding each other responsible, the more effective this will be, and we can move forward.
And I guess my last question, I'm just curious to get your take. President Trump is coming to Odessa at the end of the month to fundraise. And with the Permian Basin's economy being so fragile, do you think it's the right time for the president to come in and ask residents for money for his campaign?
I'm not really going to have any comment about whether it's the right time or the wrong time for President Trump to come in. That's a campaign issue, and we'll deal with that as we get down the road.
All right. Thank you.
Okay, it doesn't look like we have any other questions. We'll continue on. Oh, I'm so sorry. We just got one that came in from Shane. A lot of people are resistant to wearing masks despite officials asking over and over for everyone to wear them. What, if anything, do you think can be done to get people on board?
Well, Shane, thanks for the question. And really, I think the best thing that we can do is the more and more of us that take this responsibility upon ourselves, and the more and more of us that encourage our friends and family, the more and more of us who encourage everyone at work. It's up to every employer. It's up to every family leader. It's up to every single one of us. When we're in discussions and we hear people say, well, I'm not going to wear a mask, we just need to bow up, quite frankly, and say to our friends, you know, you may not like to do it, and I may not like to do it, but we're going to do it together. We're going to do it for each other. And really, that just boils down to public pressure, and it boils down to us deciding we're going to do the same thing together. So, Shane, I completely understand the question. I think the way we get people on board is we just continue to encourage each other. We continue to tell each other we have to do this together, and we make the most of it together. And hopefully that'll help people that don't want to do this to realize maybe I have a higher calling on my life towards citizens around this area, and I'm going to go ahead and do this for a while.
Thank you, Mayor Payton, for your time and for joining us today. We're going to move on. I would like to introduce Judge Johnson.
Okay, can you hear me?
Yes, sir.
Okay, all right, thank you. I don't have a lot to add. I would like to support everything the mayor's comments were about. He pretty well put everything in a nutshell. I think our personal responsibility got us through the first go round. It will get us through this second go round. The question was asked, how can we cause people to wear a mask and do all, it's events like this where we just keep reiterating what we need to do. We know we need to practice distancing. We know we need to wear a mask. We know we need to disinfect, sanitize our hands. And I think if we just continue to apply peer pressure and do these things, we've had Memorial Day, we've had 4th of July. You can probably expect a spike after these holidays. We saw it after Memorial Day. We'll probably see it after July 4th. Just ask everybody to just maintain those 4 main practices that we're doing. A lot of questions I get are scenarios of people that have been either around somebody that's been sick, or they think they have a symptom. And what I really want to encourage and remind everybody is to call 6-8 nurse. They will direct you and guide you what you need to do next. So I don't think we can get that out enough. The courthouse has changed our procedures, as some other businesses have. To come in, you have to wear a mask. That's mandated by the governor. Also, our services have changed a little bit. They're still available, but I would encourage everybody to call before they come down to see what the protocol is. But other than that, that's about all I have.
Johnson, thank you. We have a question for you. Will you mandate county employees to wear masks at work?
We have mandated if you're coming into a county facility, you will have a mask on. If you're in your office by yourself, and you choose to remove it, we haven't addressed that, but I'm sitting in my office right now by myself, and very few people on this floor, so I'm not wearing a mask. But to come to work, yes, you have to have a mask.
We have another question. Where can we see information from chat?
I've got a link to it. I can put it up on our website. I'm trying to think of another way. I can get it out there to you.
Judge Johnson, if you'll share that with me, I can, the question came from our Facebook page, so I can share that with our viewers.
I'll get the link to you, sure will.
Okay, thank you. Let's see, we have a question from Shane. We noticed the daily COVID stats. Actually, this is probably a question for you, Mayor Payton. We noticed the daily COVID stats don't include the number of tests administered. Can this please be added to the updates from the health department?
Yeah, I think Is it Shane who asked that question, you said?
Yes, sir.
We posted something, Shane, on my Facebook page last night and this morning that shows the total tested of 7,724. And so you might check on that. We're trying to work with the health department and the hospital to make sure we get those numbers. And it has a total tested negative as well. So look for that chart, and that should be out there where they can find that topic.
Okay, thank you. I think that's all the questions we have. We'll move on through the agenda. And Mr. Evans, the floor is yours.
Thank you, Tasa. Can you hear me okay? Let me first join Patrick in thanking Russell for allowing me to participate in this press conference. I much appreciate that. I am Don Evans. I serve as a member of the governor's strike force to Open Texas. We are a group of business leaders and medical experts that are been brought together by the governor to open up this great Texas and Texas economy in a safe way. More importantly, I've been a part of the Midland community now for over 45 years, and I raised my family here. I have lifelong friends here. Like all of you, I care deeply about this community and that we all love. And so I'm gratified to have this chance to talk to all of you and just give you a few of my thoughts. Before I get into them, I want to thank the mayor for his great leadership and his earlier comments during this really difficult period. And also thank Terry Johnson, our judge, and Dr. Wilson, your guidance, Russell, you and your team. I mean, your team and your staff, I just can't imagine the stress that exists over there and the hours that they're putting in, and each and every one of you are putting in. So my admiration and gratitude for each and every one of you. I did talk to the governor yesterday, and he is concerned. He's very concerned, as we all are, as we look at the rapid COVID cases increasing here in Midland and Ector County. The bottom line is that we all have a common enemy in COVID-19. And in order to defeat this enemy, we all have to be united and committed to doing what's right and what will protect us and our economy and our fellow citizens. And unless we do come together, and I would say in a concerted way, in the next few hours and days, then I think it's unlikely we're going to be able to keep our economy open. So I think the challenge is clear. It's in front of us. It's imminent. It's right now, and we have to take that challenge. As I'm confident that all Midlanders will. Look, we all know the need of people, our citizens, to feed their family, our small businesses to stay open, to pay their employees and their rents. But all of this is in jeopardy, quite frankly, unless we do come together as a community to be good citizens and protect each other. That means staying at home as much as possible, avoiding gatherings of lots of people outside your immediate family. It means social distancing, and yes, it means wearing masks when we go out into public. As we work together and stay united to beat back this growing threat to our community, wearing a mask should not be viewed as a political issue or a statement. It's really an issue of personal responsibility and our own personal civic duty. Because many people who carry this virus really don't know they don't have symptoms, and they don't even know they have it. So wearing a mask is the only way to protect others from possibility that you are contagious. Wearing a cloth mask is not about protecting yourself, it's about protecting others. It's about protecting the cashiers at the grocery store. It's about protecting the delivery drivers and the clerks at our local pharmacies. In the midst of this threat from the highly contagious and potentially deadly coronavirus, we all have the power to protect each other. And so I'm just going to urge, like the mayor has and everyone on this call has, I'm going to urge all of us to stay home as much as possible. Go out, when you go out, wear a mask. And by joining together, I think all of us can keep our economy open and our fellow citizens working. I'm one that is optimistic. I've been through lots of challenges in Midland, Texas over the years. And I've always seen the hearts and souls of this good community rise to the occasion. And I think that's exactly what's going to happen with this challenge. I think the Midlanders will really understand the seriousness of this moment. I think they are citizens that want to help their neighbor and protect their neighbor. And so I'm optimistic that we will get through this, because I really have seen the hearts and souls of this great community respond time and time and time again. So thank you again for the chance to say something and participate in this conference, and God bless Midland. Be glad to answer any questions, Tasa, if there are any.
Thank you, Mr. Evans. We don't have any questions at this time, but we'll give them a minute or two to respond. We have a question that just came in from Mitch. Mitch, go ahead.
Hi, Mr. Evans. Did the governor tell you specifically that Midland and Odessa was in danger of having their economy shut down by the state? And if so, what is the criteria that the state would look for to decide whether our economy should stay open or should be closed?
Well, he's looking at the data hourly. And in the last several days, he's become extremely concerned about the pattern and the trend in the Midland, Odessa, or Midland Ector County area. And so as he stays in touch with, those all across the state, he saw some numbers that were worrisome to him. He didn't like the trend. And one of the key indicators is really the stress on the local health care system and the hospitals. And so when you see beds begin to disappear that might be able to be available for somebody that, say, is in a car accident or has a heart attack or has something else, you have to keep beds available for that. And when the hospitals get filled up with COVID-19 patients, that just doesn't work. And so, I don't know exactly, I don't know, what the hospitalization utilization number is that he's laser focused on, but I know he's laser focused on Midland, Odessa. And I also know that he's saying that if we can't turn this trend around in the next couple of weeks or so, there's going to be a serious threat. The economy has to be shut down again. So, he's on it. He's watching it. The trends are not what he wants to see, and it's up to us to turn this around. And I'm confident that we will. But it's serious. He's we're not kidding.
And I guess, could you just, if you have the details, could you tell us what a shutdown would look like? Would it be just a total lockdown, or would it be in stages?
I don't have the details. I do not at all. He'll have to look at it at the time and see what steps he feels like he needs to take. So I do not have any of those details.
All right. And I guess I know this may be something hard to answer, but you said in the next few weeks, but how soon could Midlanders expect, if things don't turn around, the state to come?
Well, you don't know. I mean, look, that's the thing about this virus, right? I mean, Midland was really, as the mayor said earlier, I mean, we were getting through it without, any serious concerns. And yes, we had cases, and our positivity rate, though, was staying low. Our hospital rates were low. And then all of a sudden, in the last week or so, we've begun to spike. And so you don't know where that's going. I mean, you just have to watch it. As I say, I mean, this is an hour to hour, day to day kind of analysis that you have to go through. So, if we get this thing turned around in the next few days, 4 or 5 days, we're okay. And if it keeps spiking and spiking and spiking, then, the governor will have to look at it and make his decisions.
All right. Well, thank you so much, Secretary.
Yeah, you bet, Mitch.
We have a question from Stuart Doreen at the MRT. He asked if you could take some time to address the quarter-cent sales tax election taking place.
Well, I think it's critical for the Midland community. I think there's nothing more important to this community than our health care and the safety of our citizens. And at the top of that list is a good, strong hospital and medical system and healthcare system. And it's clear that the healthcare systems here in Midland and across the country are going through some struggles, financial struggles that have to be dealt with. Our great leadership and not only at Russell's level, but the Board of Governors, the Board of Trustees have all are laser focused on this, have gone to the community and said, look, here's what we need in order to make sure we've got good, solid, strong health care for all the citizens of Midland as we go forward, because the financial challenges we see in the future require it. We're just, quite frankly, we're just losing dollars that were coming to us from the federal government are disappearing. And so those have to be made up from someplace, and the good forward thinking of the leadership of the hospital and the Board of Governors and trustees, et cetera, have see that coming. And so they want to protect against it and plan against it. And that's exactly what this sales tax vote is all about. And I think it's critically important and vitally important to the healthcare delivery in Midland, Texas. I mean, if you have a heart attack, if you're in a car accident, if you have something happen tragically to one of your family members, your child or whoever it might be, you know, you want to know that there's a healthy hospital close by. And that's what the tax bill is all about, is ensuring that we have a healthy, financially sound, well-run hospital. So I think it's one of the most important votes this city has had in, you know, maybe decades.
Thank you, Secretary Evans. And I believe that's all the questions we have for you today. I appreciate you taking the time to join us on this press conference. And that concludes our press conference. I'd like to take the time to thank everyone for joining us today.